Hello, this is a brief presentation that will explain the provider's role in the WAM blood pressure cuff project. As we all know, hypertension is a leading cause of preventable cardiovascular disease. COVID-19 has significantly increased the demand for as well as use of telemedicine. In this context, the fact that many of our patients at WAM lack home blood pressure cuffs represents a new barrier to managing hypertension. Newcastle County has received a significant amount of money through the CARES Act, which is the federal COVID relief bill. Some of this funding is being awarded in the form of health equity grants. The goal of these grants is to mitigate healthcare disparities while addressing the public health crisis. Our blood pressure project is funded by a health equities grant that was awarded to Christiana. Currently, we have 600 blood pressure cuffs ready for distribution at our primary care site. The goal of this presentation is to have the providers be able to do the following. Number one, be able to select appropriate patients to receive home blood pressure cuffs. Number two, to become familiar with the blood pressure cuffs themselves, as well as the patient education materials that will be distributed with the cuffs. We want providers to be able to identify blood pressure cuff follow-up appointments as they appear on their schedules. We want to show providers how to utilize quick text to standardize their blood pressure cuff follow-up appointments. And lastly, we want providers to be able to appropriately document patient-reported blood pressures and power charts. In terms of patient selection, the major criteria are as follows. The patient should either have a diagnosis of hypertension or an elevated blood pressure in the office, so greater than 140/90, plus they would also need to have a self-reported inability to obtain a blood pressure cuff on their own. Other things to consider is whether or not the patient has Medicaid or Medicare. In that case, their insurance will not cover the cost of a blood pressure cuff. Additionally, if they're uninsured, this would apply as well. Also, if the patient has transportation or mobility issues, that would make it more difficult for them to follow up in the office in person. Once you've identified a patient, if you're in the office doing the encounter, please communicate with your medical assistant and they will take care of registering the patient and distributing the blood pressure cuff to them. If you identify the patient during a telehealth encounter, we would ask you to send a message to the PCWAM nurse pool to request a nurse visit for them to register and receive a blood pressure cuff. These are the two blood pressure cuffs that we have available. One is a regular adult size, the other is an extra large adult size, and the break point between the two is 42 centimeters in arm circumference, and this will be measured and taken care of by the MAs and the nurses as they distribute the cuffs. In terms of patient education, if time permits, please use the opportunity to counsel your patient on hypertension, and you may even find that it's useful to utilize the patient education packet that they will receive with their blood pressure cuff. And we'll show you the material itself in the following slides. Furthermore, it would be helpful to give the patient a goal blood pressure. So typically we recommend 130/80, but in certain scenarios, you may opt for a higher target. The first page of the patient education packet has a blank area where the provider can write in the goal blood pressure that was discussed. The second page shows the patient how to properly take a home blood pressure reading. There are pages devoted to lifestyle modifications that impact hypertension. There's a blood pressure log where the patient can record their blood pressure readings. And the last page discusses some symptoms indicative of hypertensive emergency, things that should prompt the patient to call 911 or urgently seek medical care. We want to have follow-up every 2 weeks for these patients receiving blood pressure cuffs, and we would keep up that schedule until their blood pressure is stably controlled. These encounters should typically be telehealth, and our MAs will do their best to clearly label these appointments on your schedule so that it will be apparent to you as you chart prep. Additionally, we're going to try and have a reminder in the reminder section, again, identifying these patients as individuals who have received blood pressure cuffs. This is the text of our quick text that we will be distributing to all providers to use during these follow-up encounters. So look for a message either through your PowerChart desktop or also through your email. We'll be sending these texts to everyone who needs them. Once you're doing your follow-up encounter with a blood pressure cuff patient, we would ask that you try and use a blood pressure that has been recorded on the day of the encounter. And if the patient has not yet taken their blood pressure that day, please feel free to request them to take their blood pressure during the encounter. And then to input the self-reported blood pressure into PowerChart, we have some screenshots. So you, of course, want to be in the ambulatory primary care provider workflow, and you want to scroll down to the vital section, and you'll notice in the red box, there's a drop-down menu, and the drop-down menu has an option for vital signs, patient reported. Click on that. A form will pop up, and you'll be able to input the blood pressure that the patient reported for that day. And to finalize the inputted value, just click the check mark, and then you're all set. So that concludes the brief overview for providers. Thank you very much. If you have any questions or concerns, feedback, just contact me. We're very excited about this opportunity, and we're very thankful for your participation. And also, big thanks to everyone who's been involved in the project thus far. All right. See you guys later. Bye.